Hi, my name is Phyllis Amon, and this is Senior News for today. In the news, according to the New York Times, many of the vaccine doses that were allotted to and stockpiled by nursing homes when they first became available have been sitting in cold storage areas unused. Thus, according to the article, there are thousands of additional vaccine doses that could be available for the general public. The issue is now getting them released from nursing homes and reallocated for other areas of the population that are eligible to receive the vaccine. There are two reasons that are suggested for this situation. Number one, when the federal vaccination program for long-term care facilities first began late last year, the allotments for the vaccine were based on the Center for Disease Control's estimates on the number of nursing home beds in the country. However, nursing home occupancy is the lowest it has been in years, which has many people thinking is related to the virus. According to the trade association, the American Healthcare Association, only 68% of nursing home beds and 78% of assisted living beds are filled. This could possibly be due to the surge in nursing home fatalities and reported issues of isolation and loneliness for nursing home and assisted living residents. Then, the Centers for Disease Control doubled the allotment of the vaccine to cover staff and the number of healthcare workers in nursing homes. But according to reports, of the 80% who agreed to be vaccinated in the first month of the program, 63% of staff members were not given shots. Some of them have now been vaccinated, although the exact number is uncertain. New York State's Governor Cuomo, recently under fire for underreporting nursing home fatalities, is pushing the Biden administration to release vaccine doses that were allocated to nursing home through the federal program, estimated at about 100,000. And the chief medical executive in Michigan is essentially raiding nursing homes for their vaccine doses, which she says have been essentially locked away in a piggy bank controlled by the two major pharmacy chains, CVS and Walgreens, that were part of the federal program. Dr. Danny Avula, the Virginia State Vaccine Coordinator, was quoted in the article saying that he has been wheeling and dealing like on a trading floor to free up tens of thousands of doses for the general population. The article reports him saying that when he began in his role as vaccine coordinator in early January, he found that large number of the Virginia population were on waiting lists for the vaccine, and less than half of the state's vaccine allotment was actually administered. One of the first things he did was cut off the supply of vaccines to nursing homes until the stockpiles that were already there were depleted. He followed that by talks with 6 of the state's hospital systems and offered them that if they released vials of the vaccine that they were stockpiling for the second doses, down the road, they would be guaranteed 2 doses for every vial that they gave up. Though the hospital administrators were skeptical at first, they eventually agreed. This approach seems to have been successful. The gap between the number of doses shipped to the states and the number of vaccines administered seems to be narrowing. And according to the Centers for Disease Control and Prevention, more than 75% of the doses delivered to the state are now being used, compared with less than 50% in late January. The article goes on to report that federal officials estimate that as many as 6 million vaccine doses are still being unnecessarily stockpiled, and that releasing them could increase the number of doses used by more than 10%. This would significantly increase the pace of the nation's vaccination program, especially important when concerns about variants of the virus are increasing. Government officials are also frustrated by the idea that doses are sitting in cold storage while millions of people are anxiously awaiting the vaccine. According to Dr. Avula, despite the reduced number of people taking the vaccine, the pharmacy chains that were part of the federal program continue to receive their vaccine allotments from the federal government. At one point in Virginia, Dr. Avula said that they had used fewer than 1 in every 3 doses that they had on hand. Please click the button below to like and share this episode. And to continue receiving senior news for today, please click the button below to subscribe. Until next time, stay safe, stay well, and stay tuned.